Hi, my name is Betsy Tesseneer. I'm the Trauma Program Manager at Cleveland Regional Medical Center. We were the first Level 3 trauma center in the state of North Carolina. We were certified in 1997 through a lot of hard work from Dr. Berenger, myself, and the staff here at Cleveland Regional.
What did you have to do to get the Level 3 certification?
North Carolina Office of Emergency Medical Services has set criteria for Level 1, 2, and 3 trauma centers, and so we had to meet all the criteria and all the rules and regulations to meet the requirements.
Are you sort of a central hub here in Western North Carolina for severe trauma?
Now, our primary catchment area is the Cleveland County area. We do get some trauma patients from Rutherford, Lincoln, and also upstate, and a few from Gaston. But primarily our patients come from Cleveland County. They are all trauma patients. We see all traumas here, and then we decide based on their injury if we keep them at Cleveland Regional or transfer them to a Level 1 center.
The Level 1 centers are, where typically do you transfer?
We transfer the majority of our trauma to CMC. Our burns either go to North Carolina Baptist Hospital or Wake Forest in Winston-Salem.
Tell me about your Med-Center Air connection here.
We have a very good relationship and close relationship with Med-Center Air. They actually are stationed here on Fridays from 9 a.m. to 6 p.m. The aircraft is on the pad upstairs above the emergency department. We have a transfer agreement with them where if we know we have a trauma patient coming into the emergency department that has injuries that we are not able to care for, we can go ahead and they auto launch and come to Cleveland a lot of times before the patient even arrives here by ground.
How many patients typically do you see in a week or a year? Do you have these kinds of figures?
I think our annual census this year is going to be about 70,000 patients.
Wow, that's a lot. It sounds like. Is that a lot?
That is a lot of patients for this emergency room. That is correct. A third of the patients that come to the emergency department have suffered some type of traumatic injury. They may not all be admitted or transferred. Most of those are treated and released with minor injuries.
Talk about your staff here. Tell me what kind of people you've got working with, the quality of the folks.
Okay, we have a wonderful staff here in the emergency department. With the rules and regulations for being a Level 3 trauma center, they have to have 16 hours of trauma education every 2 years, and this is very specific classes to care for the trauma patient. One of the courses that we do here is Trauma Nurse Core Course class that is a 2-day class. It's a national certification, and just about all our emergency departments have attained this certification. To be designated as a Level 3 trauma center, the staff have to not only do the education requirements by the state, but they have to be trained on some very specific equipment in using that is used for trauma patients. The types of equipment that the nurses have to be proficient in using is like the Level 1 fluid infuser for trauma patients, because trauma patients typically, if they are in hypovolemic shock or have a lot of blood loss, have to receive a lot of IV fluids, and so this delivers warmed IV fluids to the patient. Also, we have other equipment, of course, cardiac monitors and other vital sign monitoring equipment that they have to be proficient in the use, and they have to be proficient in doing patient assessment and looking at the patient as a whole. Now we've moved inside of one of our trauma suites here at Cleveland Regional Medical Center, and as you can look around the room, you see a lot of different equipment. This is one of the pieces of equipment that we use on trauma patients. This is a Level 1 infuser. This will deliver several liters of fluid of normal saline to the patient within just a few minutes. This delivers warm fluid, which is necessary to keep the patient from becoming hypothermic. Another piece of equipment that we have in our rooms, of course, is the cardiac monitor and all the monitoring leads with pulse oximetry and blood pressure. This piece of equipment looks kind of unusual. This allows us to look at the patient's x-rays almost in real time. Once the films are taken by radiology, this system allows the physician to look at the film here at the bedside of the patient.